All right. It's about 6:05 on my end, so let's go ahead and get started. Thank you all for joining this webinar tonight in partnership between Avance Care and the YMCA. Tonight, we are going to be talking about healthy sleep habits. And my name is Margaret. I will introduce myself in a later slide, but I am really excited to be talking to you guys today. Just a quick note, I'm going to do my best to keep an eye on the chat and answer questions as they pop up. But as long as we have time towards the end of the presentation, we'll also have some time for Q&A as well. So I apologize if I'm not able to get to the chat right away, but feel free to follow Mark's suit and raise your hand or put things in the chat. Like I said, I'll do my best to keep an eye on everything. Let's see. All right, so I wanted to start off by giving you a little bit of a literary lesson here. I will warn you that this poem is a bit grim, but I thought it did a good job of kind of explaining some challenges that some folks have with sleep. So the title of this poem is Don't Take Your Troubles to Bed, and it's written by a fellow named Mr. Edmund Vance Cook. And the poem says, you may labor your fill, friend of mine, if you will. You may worry a bit, if you must. You may treat your affairs as a series of cares. You may live on a scrap and a crust. But when the day's done, put it out of your head. Don't take your troubles to bed. You may batter your way through the thick and the fray. You may sweat, you may swear, you may grunt. You may be a jack fool if you must, but this rule should ever be kept at the front. Don't fight with your pillow, but lay down your head and kick every worriment out of the bed. That friend or that foe, which he is, I don't know, whose name we have spoken as death, hovers close to your side while you run, while you hide, and he envies the warmth of your breath. But he turns him away with a shake of his head when he finds that you don't take your troubles to bed. All right, so again, my name is Margaret Garehan, and I'm very excited to be here today to talk to you guys about sleep. So I am a behavioral health therapist. I'm licensed in North Carolina as a licensed clinical mental health counselor, as a certified rehabilitation counselor, and I'm also an associate level licensed clinical addiction specialist. So I work with a series of different kinds of people. I find myself really talking to a lot of people about sleep, which is why I volunteered for this topic. I also do some substance use work, trauma work. I work with folks that have mood disorders and anxiety disorders. And that's really just the tip of the iceberg. I have a lot more interests and specialties. But the different modalities that I use, if you're familiar, I use cognitive behavioral therapy. I lean very heavily into acceptance and commitment therapy, which is related to cognitive behavioral therapy. I use motivational interviewing. I have a couple of other clinical tools up my sleeve, but that's kind of generally about me. And I'm really excited to talk to you guys about sleep. Before I lecture you guys about sleep, though, I wanted to open up the floor for a bit of a discussion. I'm trying to make this as interactive as possible, as that's the best way I learn. So hopefully everyone else will learn in that way as well. So I've got some discussion questions here, and I'd like to at least start with the first one. And so if you guys wouldn't mind using the chat and giving me some feedback, I'd love to hear what are some common challenges that you face when you're trying to get a good night's sleep. So I'll just be quiet for a moment, and hopefully if anyone has anything to add and put into the chat, I'd really appreciate that. Conversely, if there are any other questions, if any of these other questions fit better, just give me a couple of seconds and we'll get there eventually. All right. Oh, great work. Okay, so we have got some issues, common issues, staying asleep, worries throughout the day. I imagine my poem was a bit relevant there. Monkey brain thoughts. Okay, maybe worry thoughts, I assume. Waking at 3 a.m., unable to get back to sleep. Yep, a snoring partner. Oh, goodness, I hear you. I can fall asleep, can't stay asleep, trouble falling asleep, either tired or ruminating on the day. Great use of the word. Ruminating means kind of hashing or chewing over the same thoughts and difficulty getting them out of your brain. I just can't sleep regardless of what I do. Making myself go to bed at a reasonable hour, absolutely. Getting up to use the restroom, waking up multiple times. Pets, oh my gosh, I hear you, my cat. Yes, running to-do lists, reading until my eyes almost shut, but then put the book, sorry, yes, but then put the book down and can't sleep. Hate that. Getting back to sleep after waking up, racing thoughts, restless legs. Oof, we're going to be talking about that a little bit. Falling asleep, staying asleep. Awesome. Actually, it sounds like of the participants, we have a lot of themes here. We've got some worries. We've got some difficulty falling asleep and staying asleep. We've got some environmental contributors. We've got some body contributors. Glad to know that the things that I'm going to be talking about today should be relevant to you. So really, thank you for everyone's input. I think the next question has kind of been answered by the first one, but the next question is, how do stress and anxiety affect your sleep? And do you have any coping mechanisms or coping skills? So I think it's pretty evident that stress and anxiety absolutely impact some of our sleep. So if anybody has any good coping skills that they use for the rumination or those worry thoughts before bed, I'd love to see what you've got in the chat. Yoga, meditation, nice. Deep breathing, love that. This one's a little slower. Okay, journaling and brain dumps, very good. Sleep stories, I love a good sleep story. Very good. Law and Order, oh my gosh, only if it's SVU. And CBD, okay, very good. Awesome. So it sounds like you guys have some coping skills already. It sounds like a lot of some distraction, maybe some calming techniques that you're using, some using some substances to help with sleep. Excellent work. Okay. And the next question is about bedtime rituals. Sometimes we really need a behavioral cue to get our brain knowing that it's time for us to go to bed. So sometimes if we have a strong ritual or routine before bed and we're consistent about it, it can help us to kind of jumpstart that sleepy process. Does anyone have any important parts of their routine that they think might be helpful for other people to be aware of? Brushing teeth before bed. My dentist would agree with you. Absolutely. Reading for 15 minutes. Oh, I love a good night shower. Absolutely. And some good essential oils. Yes. Right on the money, you guys. Uh-huh. Warm shower. Chopped. Great work. Love watching Chopped. Uh-huh. Yeah, sometimes watching stuff before bed, sometimes it can be helpful, sometimes it can't. It depends on the level of cognitive arousal, right? How excited you're getting, how emotional you're getting. I personally can't watch any thrillers before bed. House finally quiet. Yes. Awesome. Awesome. Has anybody found any good tips or tricks to improve their sleep thus far? I imagine if you're here, it's because you have sleep related challenges, but has anyone found anything that's been super helpful that they'd like to share? Okay. Well, those of you that have already worked on prioritizing your sleep and have been able to improve your sleep somewhat, have you noticed any benefits from that? The weather. Okay, that's interesting. All right, well, have no fear on that question because I have answers to that question in my next slide. Um, let's see. So, why do we even care? Why do we care about good sleep in the first place? Because it's super important, is why. And I'm sorry, I'm just going to work on minimizing a window here. I'm not going to be keeping an eye on the chat. Oh, There we go. So anyway, why is good sleep important? So routine and quality sleep is so important. It is crucial for our overall health and well-being. That was a mouthful. So some of the specific benefits that we look at, one is our cognitive functioning. So when we have good sleep, we have enhanced concentration, better focus, better problem solving abilities, better memory consolidation and learning retention. We also see improvements in our immune system. So we can have better and stronger immune responses, a better ability to fight off infections, and therefore reduce susceptibility to bodily infections or different viral infections. We also can see benefits in terms of our enhanced mood or our emotion regulation. So we can see when we get good sleep, there's less irritability, there's less mood swings. We have greater emotional resilience, that ability to bounce back when our emotions really are high, better stress management, lower rates of depression and anxiety and other mental health disorders. So that's super important. Then we also have the physical benefits of good sleep. So reduced risk of obesity, diabetes, cardiovascular disease, and other chronic conditions. Sleep promotes our metabolic health and it helps to regulate our hormones that are related to our appetite and our metabolism. Also, sleep is when we're doing a lot of muscle repair and muscle growth. So in order to get big and strong and stay big and strong, we have to get good sleep. One of the most important ones that I typically focus on in my work is safety. When we get good sleep, we have a reduced risk of accidents, so motor vehicle accidents, but also like any other kind of, physical or workplace accident. And that's as a result of having better alertness and reaction time and better judgment. And most importantly, sleep is enjoyable. Sleep is fun, and sleep leads us to having a better quality of life. So it just leads us to feeling more satisfied, and it really lets us to, it helps us to enjoy our leisure activities and our social interactions more. So all of this to say, sleep is super important, and we really need routine quality sleep in order to reap all of these benefits. Next, I want to talk to you a little bit about science because it's important for you to have some baseline information so that the other things that we're talking about make sense. So first is something that a lot of us have some level of familiarity with, which is our REM sleep versus our REM sleep. And so these are the two different cycles that our bodies go through while we're sleeping. And we experience them in succession, right? So we've got REM sleep, not REM sleep, REM sleep, non-REM sleep, and they take about 90 minutes each. That is different for everybody. And if you have any sleeping disorders, that also might look different. But REM sleep is, or rapid eye movement sleep, is when we have our eyes are rapidly moving while we're sleeping, because scientists are very creative with their naming. But it usually looks like vivid dreaming and muscle paralysis, whereas non-REM sleep, we're less deep sleeping and we have a little bit more freedom. So the more important thing that I want to talk to you about is what regulates sleep within our body. So a lot of times we'll hear the word circadian rhythm, or words rather, circadian rhythm, and that is an important component of our sleep. It's one of the two most important components of our sleep, excuse me. So the circadian rhythm is our internal biological clock that regulates the timing of various physiological processes. So these physiological processes are like our sleep and wake cycles, our hormone secretions, and actually like our body temperature fluctuations. The problem is that our circadian rhythm is actually a little bit longer than 24 hours. Therefore, having routine sleep where you're sleeping at similar times every day, it can help to control that drift of that circadian rhythm system. If you are irregular, our circadian rhythm system gets a bit confused, and that can lead to us having difficulty with initiating sleep, like some of you guys have mentioned. The other factor that's very important that less people know about is our homeostatic drive for sleep. And I imagine this might be contributing to some folks' difficulty with initiating sleep or maintaining sleep. But our homeostatic drive is our body's need for sleep, and it accumulates over time and it is influenced by a number of factors. So when I was learning about this, it was explained to me to consider it like a balloon. So our homeostatic drive, if it is a balloon, we do things throughout the day to blow air into our balloon or increase our homeostatic drive for sleep. So things such as like exercising or getting up at a decent time, avoiding naps, minimizing our use of stimulants like caffeine. All of those things can contribute to us needing sleep at night. And I like to think about it as like putting money into a Goodwill account, right? We are building up that goodwill to get a good night's sleep that night. And so we're not just blowing smoke when we say it's really important that you get a good amount of exercise and you're having a good diet and you're drinking enough water. I know that stuff just kind of sounds like lip service from us medical providers, but I promise, like, it actually does really impact your body's perceived need for sleep, which is highly going to impact your ability to fall asleep and stay asleep at night. And so there are many factors that impact our sleep and our ability to sleep. So that includes the environment that we sleep in. Someone mentioned noisy animals. I hear you. But we're also thinking about like the temperature of the room, any kind of distractions, interruptions, any kind of lights sometimes can be really bothersome for people. Like I said, our typical diet, so caffeine intake and nutritious foods, exercise and movement throughout the day, which again, it does like contribute to our homeostatic drive. But when we are our homeostatic drive, but just be mindful of the time of day that you're doing the exercise in. Stress is super important to consider. We cannot thrive when we are under an immense amount of stress, and that is also going to impact our sleep. I have found in my work that oftentimes people's daytime affects, right? The level of stress that they're experiencing and how they're dealing with that stress during the day impacts not only how well they sleep, but also what they dream about. And so the science behind it is that when we're stressed out, that impacts us on a hormonal level. So you might see changes in our cortisol, which is involved in our circadian rhythm as well. Also, just of note, different medications can impact our ability to sleep. So stimulants, depressants, steroids, things of that nature can also impact our ability to fall and stay asleep. One thing that I really wanted to touch on were sleep disorders. So, sleep disorders are relatively common, so much so that they impact between 50 and 70 million Americans. So, 50 to 70 million Americans suffer from a disorder of sleep and wakefulness of some kind. There are about 90 different kinds of sleep disorders, so we're absolutely not going to talk about them all. But I did pick three for us to focus on. However, the 90 sleep disorders, or all sleep disorders, are characterized by either excessive daytime sleepiness, difficulty initiating or maintaining sleep, or abnormal events that occur during sleep. So I'm going to talk about all of those things. So one of the more important ones that I see day to day is sleep apnea. And you might think to yourself, Margaret, you're a therapist. What do you got to do about sleep apnea? That's what your doctors talk to you about. And they should. They should absolutely talk to you about sleep apnea. But if you're going and talking to a sleep professional, whether a therapist or a doctor or a PA or NP, they're going to want to ask you about your sleep and what it's like. And so sleep apnea is a condition where your breathing repeatedly stops and starts while you're sleeping. It's like your breathing takes little breaks throughout the night. And sleep apnea happens because some of our muscles in our neck, they relax too much, and it can cause a blockage in our airway. And when that blockage happens, you might snore really loudly, you might sound like you're gasping for air. And so it's a really important physiological issue to get addressed. Sleep apnea, untreated sleep apnea, can lead to a host of other problems, cardiovascular issues, issues with your cholesterol, like really obscure things. things. It can also impact your memory and your ability to maintain attention. So if you are a snorer, or if you have any bed partners that have ever expressed any concern about you sounding like you're not breathing at night, I really encourage you to talk to your provider and consider getting a sleep study done, just to make sure everything is good. Lots of people are affected by sleep apnea, and a big myth that's out there is that sleep apnea is solely it solely affects people that live in larger bodies, but that is not true. Sleep apnea can affect people of all shapes and sizes, and it has a big our physiological makeup, or like the way that our bodies are kind of designed, that strongly impacts our ability to maintain our ability to sleep at night, and breathe at night. So even if you might not think that you are in a group that would be impacted by sleep apnea, please do not be fooled. Many people can have sleep apnea. The next one is a little bit more my forte, which is insomnia. So I'm going to be honest, some of the things that I'm reading in the chat, they feel a little bit like insomnia. But insomnia is essentially when you have difficulty falling asleep or staying asleep, even when you really want to be asleep. It's like when you're trying to sleep, but your mind keeps racing, or you're waking up during the night, or you can't go back to sleep, things of that nature. For sleep apnea, or sorry, insomnia in general, we want to see this lasting over a period of time. If my memory serves me correct, it's about 6 months. We want to know that it's impacting you more days than it's not, and that it's impacting your life some type of way, right? It's getting in the way of your ability to work, or maintain friendships, or other kinds of relationships, or take care of yourself. So if you think that you might have insomnia, I encourage you also to talk to your provider about this. There are all different kinds of treatment options for insomnia. There are some people that use medication for their insomnia, and there are also some people that receive therapy for their insomnia. And I'm talking psychotherapy, like with a provider like me. We can actually do cognitive behavioral therapy for insomnia, where we look at your behaviors related to sleep, your patterns of sleep, and we can analyze them to create a plan to improve the quality of sleep. It's a little bit too complicated for us to get into today, but essentially you are taking data, you're logging your sleep patterns, and we use that data to try to compress your quality sleep and then gradually expand your quality sleep throughout the night. So CBTI, or cognitive behavioral therapy for insomnia, it's incredibly effective. It does take a couple of weeks into months to be fully effective, but it has worked wonders for my clients. So if you think you might have insomnia, I encourage you to talk to your provider, but also consider therapy for insomnia. And the last bit is parasomnias. So parasomnias are different weird things that can happen to us while we're sleeping. So someone mentioned restless legs in the chat. That's an example of parasomnia. You can also have sleepwalking or sleep talking. Some people engage in sleep eating. Parasomnias, there is not necessarily a distinct treatment for them, but one thing that can be helpful is just being mindful of your stress during the day. We found a correlation between folks' level of stress during the day and how severe their parasomnias are. Of course, there are some medications that might be able to help, especially for restless leg syndrome. But if this is getting in the way of your good sleep, really, if sleep apnea, insomnia, or parasomnias are the true root of your sleep problems, then just doing what we call sleep hygiene is not enough. So, we're going to be talking about sleep hygiene today, which is when we are just being mindful of our routines and just creating an optimal environment for our sleep and things like that. Typically, if you have a sleep disorder, you need treatment and intervention beyond just good sleep hygiene. So if any of these sound like you or could be you, I encourage you to talk to your primary care provider, talk to your therapist, talk to whoever is on your care team, and see about getting some referrals if they find it appropriate, like to a sleep disorder clinic, or to a sleep specialist, or to a therapist that does cognitive behavioral therapy for insomnia. And just a quick note, there are more people than me that do that. So we have a couple of people within Avance Care, but you can also Google it online. There's like a registry of folks, and I'm sure that there are other people in North Carolina that provide that as well. All right, we are going to be doing a game, and I try to get creative with this, but I'm trying to find a little bit more of an interesting way to to present information that's a bit more interactive. So the game that we're playing is Two Truths and a Lie. And I kind of adapted this game a little bit. So essentially what we're doing in this game is trying to find the answer that's wrong. And then we're going to talk about why it's wrong and why the other two are right. So we're going to do this 5 times, and I'm going to just launch a poll for each of the questions. And I want you just to like review the statements and pick the one that you think is not right. And then I will review the answers with you guys and we'll learn that way. All right. So 1 second, I am going to launch a poll and then I will read it to you. All right, so the first poll that you guys should be able to see on your screen. Oh, I'm getting some responses already. Excellent. So the question is, the 3 statements are, yes, if you wouldn't mind, I see a couple of people answering 3 in the chat, but try to answer it in the poll if you wouldn't mind. So the options are spending time outdoors helps to regulate your sleep-wake cycle, engaging in regular physical activity during the day promotes better sleep at night, and drinking caffeinated beverages in the evening can improve your quality of sleep. All right, we've got lots of interaction here. Thank you, y'all. Nicely done. Give it a couple more seconds. Don't see a poll. Okay, great. Glad you found it. Awesome. All right, we're just going to end the poll just in the interest of time, but thank you everyone for your participation. Here are the results, and the correct answer is number 3, which means number 3 is a lie. So obviously drinking caffeinated beverages in the evening, it can disrupt your quality of sleep. Again, if we're thinking about that homeostatic drive, it's going to deflate your balloon when you're trying to go to bed. So caffeine is a stimulant. Please be mindful of your caffeine intake. And obviously it can interfere with falling asleep, and it can lessen your sleep duration, which means you're going to sleep for less time. So it's generally recommended to avoid consuming caffeine and other stimulants close to bedtime. The rule I'll usually give to folks is about 3 hours before you're planning to go to bed, making sure that you're being mindful of your caffeine intake. But if you're already having sleep problems, I would say try to reduce the caffeine intake during the day as much as you possibly can. All right, so for the other 2 questions or statements, so number 1 is right. So spending time outdoors, especially during daylight hours, that helps us to get more access to natural light, which can help to regulate our circadian rhythm or our body's internal clock and help to produce better sleep at night. Kind of similar to number 2, which is when we engage in regular physical activity during the day, but avoiding vigorous activity close to bedtime, that can help to increase our alertness and make it harder to sleep at night. During the day. I'm sorry, that was worded strangely, wasn't it? Anywho, so when we're engaging in regular physical activity during the day, we are filling up that balloon, right? We are getting as much momentum as possible for good sleep at night, but we do want to avoid, oh, I see, I used a lot of comments there. We want to avoid rigorous activity before bedtime, as that can promote alertness and wakefulness, and it can get us really like excited and increase our physical arousal before bed. All right. I am going to advance us to the next slide and we will do the next one. Great work, folks. Oops. All right. We've got another go. Check out the poll when you've got a chance. We'll give you some time. It seems like some of you guys are paying attention. Lots of you guys are paying attention. Great work. We'll give it a couple more seconds. All right, we'll call it quits there. Great work, everyone. You were listening earlier. So yes, as a reminder, napping during the day, it can decrease our need for sleep. Again, deflate our balloon and decrease our homeostatic drive for sleep. And it can also impact our circadian rhythm. Our body gets really confused. We're like, what? I'm supposed to sleep right now? Maybe I should be releasing hormones a little earlier in the day. So if you do need to nap, I advise you just to keep it short, 20, 30 minutes, and try to avoid napping too close to bedtime, as that can obviously further impact our ability to fall asleep. So number two is true. When we're able to maintain a balanced diet and avoid super heavy meals and large amounts of fluid or spicy or acidic food close to bedtime, that helps us to be able to avoid discomfort and ultimately sleep much better. I'm sure I'm not the only one that experiences acid reflux if you have too much Mexican before bed. And then number three, so obviously this is true as well. It kind of mimics something that we talked about in the last slide, but engaging in physical activities during the day, it can help to manage our stress. And some examples of that are spending time with our loved ones, or doing your hobbies, or practicing relaxation techniques. See the chat for some examples of that. All of these things, if we're able to better manage our stress during the day, we're going to be able to sleep much better at night. All right. Let us go on to the next one. We just have a couple more. All right. Our third two truths and a lie. You guys should be able to see it on your end. Pick out the lie. You guys are fast. Keep it coming. I know there's a couple more of you. Nicely done. Nicely done. All right. Let's end it there because it doesn't seem. And we've got the results. Again, listening. So yeah, number two is the lie. It's really important that we stick to a consistent daily schedule, including waking up at the same time and going to bed at the same time, even on the weekends, as this can help to regulate your body's sleep-wake cycle. I get a lot of flack from my clients about maintaining this even on the weekends, because they say, Margaret, I want to wake up later. Like, it's Saturday, it's Sunday. I have to wake up at 5 a.m. Monday through Friday. I want to treat myself. And I say, absolutely. I want you to treat yourself too. But you cannot treat yourself and have consistent good sleep at the same time if you've got a sleep disorder. So when we delay our wake windows in the weekends, that can cause kind of like a jet lag effect when we get to Monday. And it can really exacerbate our Sunday scaries, if I'm being honest. So what I mean by that is, say you typically wake up around 7 a.m. Monday through Friday, but on the weekends, you want to wake up at 9 a.m. All fine and dandy, especially on Saturday, because you're probably getting a lot of sleep from the night before. You're probably getting 2 hours extra sleep, unless you're a party animal on Friday nights. But as it comes to Sunday, right, if you're waking up at 9 a.m., you're probably not going to want to go to sleep or able to go to sleep until a bit later than you typically would Monday through Friday, which means by the time we get to Monday, you're probably going to get at least 2 hours less of sleep, which is going to make Monday even worse. So I really encourage everyone to maintain consistent sleep schedules, even over the weekends. Your future self will thank you, I promise. All right, so number one is the truth. So practicing relaxation techniques like deep breathing or meditation or yoga, super helpful. Number three, there are different mental and physical conditions that can contribute to your poor sleep. So it's really important that you talk to your providers about your diagnoses, even if they're not sleep disorders, and find ways to effectively manage the different conditions that you may have to reduce the impact on your sleep. Just another quick note, you might also want to talk to your provider about your medications and if they might be impacting the quality of your sleep at all. All right. Here is our penultimate or our next to last poll. Apologize. All right. Poll is launched. Take a gander and choose a lie. With the quickness, y'all. Yes. You are engaged. You are present. You are answering my polls. Thank you. All right. We'll call it quits there so we can have extra time for Q&A. Um, you guys all got it right. And number two is a lie. And I really should have made this more difficult because you guys are getting almost 100% every time. But anywho, so number two is a lie. For some people, sleeping with the TV can be helpful. Some people really, yeah, see, I know, I think you're the Law and Order guy, aren't you? Or person, I shouldn't assume. Yes, some people do find TV helpful. I find TV helpful. I like the noise. I like the ambient light. It can be a nice little distraction. However, sleeping with the TV can also disrupt some people's circadian rhythm. It can be a distraction for them. So typically I recommend not using the TV, but if somebody comes to me and they're like, Margaret, sleeping with the TV makes my life a whole lot better, and that's not the problem when it comes to my sleep, I am not going to tell you to turn that sleep off or that TV off. So no worries about that. Everybody's body is different, but generally, most of the time, having like interacting with TV or even like our phones or any kind of screen before bed, sometimes that like blue light can disrupt our circadian rhythm too. Sometimes it can be very activating. We're watching something, reading something that's super interesting, which makes it difficult to fall asleep. So be mindful of what works for you and your body. But if you're having difficulty with sleep and you are using like devices before bed, you might want to give it a shot to try a couple of nights without those devices and see how that goes. So, with number one, I thought this was super interesting. The National Sleep Foundation actually suggests that we should have bedroom temperatures between 60 and 67 degrees Fahrenheit, obviously, for most people. They believe that this range can tend to promote better sleep because it helps to lower your body's core temperature, which naturally drops as your body prepares for sleep. But again, it's essential to find out what works best for you personally. This is a general advice, but not specific. And number three is also true. So it is incredibly important that you're super comfortable while you're sleeping. Having any kind of pain or discomfort can be very distracting while you're trying to fall asleep. So really invest in that bed, invest in a good mattress, invest in excellent pillows. We spend a significant portion of our day, like a third of our day asleep. So you might as well have an enjoyable sleep if you can throw some money at it and fix it. I say do it. All right, we will now be going on to our very last two truths and a lie. And I will launch our last poll. All right, answer that one, and we'll get to do something fun after this. I hope you guys can see the poll. I haven't gotten any answers yet. Poll is not up. Okay, let me unshare and relaunch it. One moment. Thank you for the feedback. Can you see the poll now? Yes. Okay, great. Wow. Okay. See, I knew you guys were paying attention. Ooh, this was a trickier question, and you guys still got it. Excellent. Okay. Good engagement. We've got some competing theories as far as what is the lie. Couple more people. Give me a vote. Awesome. All right. This one was a tricky question. So don't be mad at yourself if you didn't get it right. I promise. Okay, so the lie was number one. So a lot of people enjoy waking up with a good cup of coffee in the morning. It can help them to feel more alert, but consuming caffeine when you wake up is not necessarily necessary. And sometimes it can even get in the way of good, healthy sleep routine. Again, it's an important concept for us to remember that our bodies are naturally regulating systems. So sometimes when we're introducing additional substances like caffeine, even in the morning, we're reducing our body's own resilience and our body's ability to create the hormones necessary to get us alert and awake. So while I do enjoy some caffeine first thing in the morning myself, for some people, it can really, again, decrease your homeostatic drive for sleep. It can reduce your body's ability to wake up in the morning naturally, and it can increase your rate of sleep inertia. So, sleep inertia is when we are waking up and we are still feeling asleep. So, that might feel like sluggish in the morning or a little bit of brain fog or even being a little bit out of it. That is so true. And I'm very sorry. Someone in the chat said some people have to get up before the sun is shining. And that is true. And I wish it weren't the case. Okay, so number two is true. If we're able to maintain consistent sleep and wake cycles, even on the weekends, again, that helps to regulate our circadian rhythm. And it can help to continue to regulate some of our hormones that are involved with sleep. So, melatonin or cortisol or the human growth hormones. So, when we're able to maintain a routine sleep, we're able to stabilize these hormonal levels, and that can positively impact a lot of different kinds of parts of our body and our health, including our metabolism, our stress response, our immune function, and also our ability to sleep. So, when you're able to, I think number three, we are saying that it's super important that you expose yourself to natural sunlight as quickly as possible. Understanding that sometimes when you wake up, the sun might not be shining, as someone mentioned in the chat, but when we're able to expose ourselves to light as quickly as possible after we wake up, it again sends a signal to the brain that it's time to wake up, it's time to be alert, and it helps to suppress the production of melatonin, which is the hormone that can make us feel sleepy, and it promotes energy and alertness during the day. And again, it can reduce the sleep inertia that we experience. For those of us that are not able to wake up with the sun or after the sun, some things that you can really consider, they have these, and I forget what they're called, but they're essentially alarm clocks that simulate like the sun coming up. You can also invest in a light lamp. So we do light therapy, which is frankly nothing that fancy. You can get them on Amazon, but some folks that have circadian rhythm disorders or even like depression, there's a lot of studies to show that engaging in light therapy can help to kind of correct some of those levels on a hormonal level. So if you are getting up at a time that is not when the sun is up, I encourage you to consider investing in fake light to help to regulate your circadian rhythm. All right, so we are all done with polls and we are all done with the educational portion of this. However, we're going to do a cute little mindful activity. So this is called a mindfulness of breath. It is a meditation. And I would like for you all to just kind of take a minute to check in with your bodies. I want you to kind of settle into a comfortable position. You can allow your eyes to close. If you're uncomfortable with closing them, feel free to keep your eyes fixed on something in the room that you're in and just soften that gaze. We're going to start by taking several long and slow breaths. And I want you to really breathe in fully and exhale. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. If you're able to, I would love it if you would try to breathe in through your nose, and you can either exhale either through your nose or through your mouth. And I want you to just take a couple of moments to just notice your breath and allow your breath to find its own natural rhythm. Bring your full attention to noticing each in-breath as it enters your nostrils, travels down to your lungs, and it causes your belly to expand. Notice each out-breath as your belly contracts and air moves through your lungs and moves up through your nostrils or your mouth. Just really invite your full attention to flow with your breath. Notice how the inhale is different from the exhale. You may experience the air as cool as it enters your nose and warm as you exhale. And as you turn more deeply inward, begin to let go of the noises around you. If you're distracted by any sounds in the room, simply notice them and bring your intention back to your breath. Simply breathe as you breathe, not striving to change anything about your breath. Don't try to control your breath in any way. Observe and accept your experience in this moment without judgment, paying attention to each inhale and each exhale. If your mind wanders to thoughts, plans, or problems, simply notice your mind wandering. Watch as the thought enters into your awareness as neutrally as possible. Practice letting go of the thought as if it were a leaf floating down a stream. In your mind, place each thought that arises on a leaf and watch it as it floats out of sight down the stream. When you're ready, bring your attention back to your breath. Your breath is an anchor that you could return to over and over when you become distracted by your thoughts. Be grateful to notice when your mind has wandered and observe the types of thoughts that hook or distract you. Noticing is the richest part of learning. With this knowledge, you can strengthen your ability to detach from your thoughts and mindfully focus your awareness back on the qualities of your breath. Practice coming home to the breath with your full attention. Watching the gentle rise of your stomach on the in-breath and the relaxing letting go on the out-breath. Allow yourself to be completely with your breath as it flows in and out. You might become distracted by pain or discomfort in the body, or twitching or itching sensations that draw your attention away from the breath. You may also notice feelings arising, maybe sadness or happiness, frustration, contentment. Acknowledge whatever comes up, including thoughts or stories about your experience. Simply notice where your mind went without judging it, pushing it away, clinging to it, wishing it were different, and simply refocus your mind and guide your attention back to your breath. Breathe in, breathe out. Follow the air all the way in and all the way out. Mindfully be present in the moment with your breath. Again, if your mind wanders away from your breath, just notice it without judging it, whether it's a thought, an emotion, or a sensation in your body that hooks your attention. Gently guide your awareness back to your breath. As this practice slowly comes to an end, work on bringing your attention back to the present moment. Expand and notice your entire body, and then beyond the body to the room you're in. And when you're ready, gently open your eyes and come back fully awake. The breath is always with you as a refocusing tool to bring you back to the present moment. So set your intention to use this practice throughout your day and before you're sleeping to help to cultivate and strengthen your attention. So this was an example of a meditation that you might be able to use before bed. The kind of meditation that this is called is based on a concept called cognitive diffusion, or the practice of letting go of your thoughts, of being objective about your thoughts and practice observing them rather than engaging with them. So if you found this practice to be particularly helpful, I encourage you to look into acceptance and commitment therapy. That is the basis of this meditation. And it can be a really helpful tool to consider if you're struggling with worry thoughts or rumination. All right, so we are at our last slide, and I am going to open the chat that is already open, but so figuratively open the chat for any specific questions that anyone has. So if anyone has any questions, pop them in the chat and we can spend the next 5 minutes talking about them. But as we are waiting for folks to have any or pose any questions that they've already got, I'd like to remind you that you can scan this QR code to learn about Avance Care Behavioral Health. And you can call the number on the screen to inquire about various appointments. We do have another lecture next month, but I'm not sure of the time and the date or the subject quite yet. Perhaps our marketing folks might be able to get that to me before we're done. Okay, so we've got one question from a person named Marcy. The question is, if you wake up and can't get back to sleep, should you get up, change rooms, and do something different for a while? So this kind of depends. Some people can wake up and get back to sleep pretty quickly. But if you're having difficulty with getting to sleep, and you're spending 30, 45 minutes getting 30 or 45 minutes with getting back to sleep, and this is happening on a recurrent basis, I do encourage you to change the venue. So you can either sit up in bed, get out of bed and stay in your bedroom, or go to a different place and do something else. What it is that you're doing during that time doesn't super matter. As long as it's something that is safe. So don't be turning on your oven or your stove or ironing things or straightening your hair or even really taking a bath. I want you to do things that you could safely fall asleep during if the need arises. And then the next question might be, when do you go back to sleep? So going back to sleep would be based on your body's cues. We have these things called sleepy cues. That might be when your your eyelids get droopy or heavy, or your head kind of falls, or you're losing track of time. When those sleepy cues start to come back, then that might be a good time to try going to bed again. And if this is becoming a recurrent issue for you and the little tips and tricks don't work, I encourage you to talk to a provider that is good at sleep. I said acceptance and commitment therapy. So I am going to put that in here for everyone to see. There are workbooks out there that you can use, and there are lots of therapists that are trained in it. It's a different offshoot of cognitive behavioral therapy. It's my personal preference of what I use. So yeah, I encourage you to check it out. Patricia? Okay, Michelle asked, I'm trying to wean myself off of sleep meds, but when you're so sleep deprived, you find yourself giving back into the meds. Absolutely. I really appreciate if you are trying to wean off of your medications, talk to your providers about that. You might not be able to just wean off of them without another plan in place. Sometimes we can develop a physiological dependence on the meds. Sometimes we can develop a psychological dependence on the meds. So, weaning off of the meds, if it is not going well, I encourage you to ask for help. There are absolutely different strategies that might be useful for you, and I encourage you to talk to a sleep specialist if that is the case. I like Sleep Stories Calm app. I also like the Sleep Stories on the Calm app. Let's see. Does weather affect sleep cycles? I find that when there's a big change, I'm literally up all night. That's a great question. And that frankly hasn't come up too much in my research thus far. I have some theories. Obviously, time changes, whether you're traveling through time zones or with the like daylight savings time, that can greatly impact our sleep cycles. I'm not too sure about that though, Michelle. I wonder if that might be kind of like a sensitivity to changes in barometric pressure. I wonder also if maybe like some environmental like noises or lights or something like that might be impacting you, but that's a bit of a peculiar one. It could also, sometimes we have these like different rules that our bodies create. So sometimes we can have like a behavioral component to our sleep. So for example, if I'm super excited for something the next day and I know that something exciting is happening, I'm going to have difficulty with going to sleep. But it can also happen on a recurrent basis, right? So if I'm continuously doing exciting things on Fridays, I'm probably going to have a difficult time sleeping on most Thursdays, even if my Friday is pretty boring. So it could be like a behavioral response that you're experiencing, but that's a bit interesting. I'm not sure about that one. Low barometric pressure headache. See? Okay, so marketing was super sweet and they put all of our information in the chat, but our next presentation will be in person at the Alexander YMCA in Raleigh on March 20th, and it is going to be taking a deeper look at emotional and disordered eating. Oh, I think I might want to go to that. So you can find that information and all of the details for that on the events section of our Facebook page. And our lovely marketing team has also put the link in the chat for you. And with that, the chat is dying and we are at 7 o'clock. So thank you, everybody. I'm glad that you guys enjoyed this. You guys were really great participants and I really appreciate everyone. If you have any further questions or needs, feel free to reach out to us at Avance Care. We're happy to help. And I encourage everyone to go to therapy because I'm a big fan. Ginny, I think that you raised your hand, and I'm not sure if that was on purpose or not. But if you've got a question or feedback for me, feel free to put it in the chat because I don't believe I can unmute you. You are so welcome, everybody. I appreciate all of the feedback. Oh, okay, no worries, Ginny. All right, I'm going to hang out for just a couple more minutes in case we have any folks that are lingering with any questions and maybe a bit of stage fright. But again, thank you everyone for your participation and your attention tonight. All right, we are winding down to just a handful of folks. Again, thank you very much for coming tonight. I am going to end this webinar and we look forward to seeing you next month at the Alexander YMCA to talk about eating. Bye, everybody.